my name's Adam and this is Chrissy, and today we're talking about how you can use Dr. K kinesiology tape to help with lower back pain. So lower back pain is a pretty common condition in society, and taping can be effective in helping to support posture and movement to aid in multiple facets of life, whether it be work, recreation, sport. Alright, so for this particular taping application, we want to have the patient bent forwards, so we want to cushion the bend in the middle so that her back's flexed, so that we've got some level of stretch and lengthen through the area. We're looking to run two vertical pieces parallel either side of the centre of her spine, aiming to begin at the little bony bits at the base of your hips there that you can feel when you poke around. So we're going to measure a piece that runs not the full length, because we're going to allow for a little bit of lengthening as we stretch the tape. So we're going to cut two pieces that length, and we also want to measure a piece that's going to run horizontally across the point of pain, so that might be down low, or it might be sort of slightly higher or up towards the middle more. And you can vary that depending on what particular condition you're dealing with and what time. So we're going to measure that to run from sort of one side to the other. And as with all of these taping techniques, we're going to cut the corners off to stop it from peeling. So we're going to prepare the base piece of our tape by folding and then tearing along that fold. And then we're going to create a little tab and remove the last portion of the paper. So this little piece is going to be our base. We're going to find those bony bits of your hips that we were talking about, making sure that we're just off centre from where our centre of our spine is. We're going to place that down, give it a rub to make it stick, and then we're going to peel off the length of the tape, measuring about 50% tension, so you can come 100% and back about halfway. And then stick down, all by the end, which is going to go on without any tension. And then we're going to repeat that on the other side. So same thing, tear and fold to create our little tab. Find our little bony origin point down the base there. Peel up and apply that 50% tension along the length of the tape, with the last little tail going on without any tension. Give it a rub to make it stick. And then our horizontal piece, we're going to fold in the centre, tear along that line, and we're going to place the centre down without any tension on it. So in some cases there's quite a hollow in the middle of the back between the bulk of muscles either side, so we're going to make sure that we don't end up with the tape flicking off and peeling through the middle. So having a point of no tension through the middle is really important in that context. And then once we've got our little base piece on, we're going to peel the edges off, and we're going to apply about a 75% tension while spreading a bit of pressure there to support that area of tape. So all the way plus off a little bit, and then come back down and peel all but the end. And we're going to repeat that on the other side. So a bit of support for the tape, 75% tension, place down, and tape goes on without any stretch. So as with all kinesiology taping applications, we want to ensure the tape stays on effectively. So in lower back applications, it's particularly important to be careful when you're getting dressed or showering. So patting dry rather than rubbing with the towel, and making sure clothes don't catch on the portions of tape, particularly where they cross the other pieces of tape or the horizontal piece is more prone to coming off. Lower back pain is a very common condition within the community, and having it evaluated and treated effectively is really important. So there's a lot of strategies for helping to control pain, anything from medications to heat packs to stretching to massage, core stability exercises and those sorts of things. But I think a good plan and a good strategy of incorporating multiple facets of care into the approach is usually the best method. So for more information, just visit supportstrap.com.au.